Broadcast is now starting. All attendees are in listen-only mode.
Great.
Yes.
Can you all still see my screen?
Yes.
Yes.
Great. Okay, perfect.
Hi, I see that a few people are starting to join. My name's Sophia Hassan, and I'm with the Reproductive Health Supplies Coalition. The webinar will be starting in a few minutes.
So welcome those of you who are joining. I think we'll just wait for another couple, maybe just one more minute before we get started to allow some more people to join. Okay, well, why don't we go ahead and get started? We're just a couple minutes after the hour. And we have, this is Natalie Kapp. I'm one of the co-chairs of the Safe Abortion Supplies workstream. And we're really glad to have all of you joining us today for what will be a great webinar. We have two speakers who will be talking to us. The first is Sophia Hassan, who is based in Washington, D.C., and the Market Development Officer for Reproductive Health Supplies Coalition. She served in this role for almost 3 years. One of her major responsibilities is to guide the coalition's work in the area of safe abortion supplies. And our second speaker is Ben Bellows, who is based in Washington, D.C. as well. He's the Chief Business Officer at Nivi, a consumer-facing digital health company that empowers individuals with information throughout their health journey. He works with multiple organizations and agencies to optimize engagement with their key audiences at Nivi, to identify and address challenges in realizing intended outcomes for the populations that they serve. He previously was a health systems researcher at Pop Council, where he designed and managed studies of performance-based financing, reproductive health vouchers, supply-side contracting, and health system strengthening in government and non-state partners. He has published more than 50 peer-reviewed manuscripts and several book chapters, and holds a PhD in epidemiology from the University of California, Berkeley. So welcome to both of our speakers, and we'll get started with Sophia.
Great. Thank you very much, Natalie. And again, my name is Sophia Asan, and I welcome you to this webinar. As you will see, we'll go ahead now and get started with my presentation. And at any time, if you would like to enter questions, please feel free to do so in the questions box on your screen. And those questions will be answered during the Q&A session at the end of the webinar as time permits after Ben and I speak. So I'm pleased to share with you today some lessons learned from a 3-year project that the Coalition Secretariat embarked on back in mid-2018, leveraging the role of national distributors to accelerate access to MA Combi packs in sub-Saharan Africa. Next slide. And today we'll briefly walk through the project goals and methodology, spend most of the time on the lessons learned, and then move to a brief conclusion. Next slide. So in terms of the goal of this project was overall at a high level to test the efficacy of innovative finance-based approaches with commercial distributors in sub-Saharan Africa as a means of enabling the distributors to play a more active role in increasing Combi pack access. And as some background, as most of us are well aware, Combi packs are most often accessed by women in sub-Saharan Africa from the supply chains that are managed that involve SMOs, or from the public sector. Local commercial distributors, however, are still critical supply chain actors, regardless of which sector a woman or a girl accesses her Combi pack. And the manufacturers don't actually contract directly with commercial distributors, often for a long-term arrangement. And at the bottom of the screen, we see, as we know, when we speak of Combi packs, we are referring to the mifepristone misoprostol co-packaged product of 1 mifepristone tablet and 4 misoprostol tablets. Next slide. So with this project, it consisted of 2 primary phases. The first was a diagnostic, in which we conducted a landscape assessment and introductory research. The landscape assessment was actually contracted to Man Global Health, who conducted it for us in late 2018, finishing up in early 2019 with a publication of the landscape assessment report, as well as a webinar that was shared during the first quarter of 2019. Then in the implementation phase of the project, we performed in-person interviews and market research with travel to 3 countries. I traveled to Lusaka, Zambia, as well as to Kampala, Uganda, and a colleague of mine on the Secretariat, Aminata Lenormand, who was then a full-time member of the Secretariat, traveled to Burkina Faso for us. The implementation phase also has included activities being conducted in Zambia and the planning of activities in Burkina Faso, which would commence post-registration. And unfortunately, as has been the case for so many of us, the activities that we had planned in 2020 did need to be canceled due to the pandemic and its impacts. We had anticipated selecting another few countries and conducting a second round of implementation, but that was canceled. Next slide, please. So to briefly touch on what has been, what was strategized and done in Zambia. Sun Pharmaceuticals had their quality assured Combi pack, which was already registered in Zambia. It had actually not been actively distributed for about a year in the country as they had discontinued their relationship with a local distributor who had been distributing the product. So we contracted with another local distributor based in Lusaka, and this distributor had not previously sold the Combi pack from Sun or from anyone else, and they did, however, have an existing relationship with Sun Pharma. They managed other products, other pharmaceutical products for Sun. So this distributor procured the product from the manufacturer after we finalized our contract with them. And Sun Pharma fulfilled that PO. And actually it shipped to Zambia just prior to so many of the lockdowns beginning. It shipped in February. So we got in just before so many of the lockdowns and the issues with ports of entry were beginning. Since that time, the manufacturer, Sun Pharmaceuticals, has marketed the Combi pack in Zambia. While it's been very much so in the Lusaka area, it has also been marketed significantly in Copperbelt and less so in other areas of the country, quite understandably, especially given the restrictions that have been in place in the country with COVID. Now, the marketing has been done, or detailing, as is often referred to as well, has been done in health facilities as well as in pharmacies, public sector and private sector. The distributor has during this time worked in tandem with the manufacturer to then sell the Combi packs. And as the coalition secretariat does not have a footprint in countries, we received the support of a local and organization who conducted some verification activities for us to ensure that the product was indeed being marketed and sold. Next slide, please. Now in Burkina Faso, we had coincidentally also created plans to work with Sun Pharmaceuticals. Now, it was not by design that we would be working with Sun Pharma in both countries. It simply worked out that way as we were looking for what opportunities were presenting themselves to us and seemed to align with the direction of the project. So the activities that were performed, as you see, included the manufacturer, Sun Pharma, identifying the partners who they would be working with for managing the supply chain, for seeking the registration, as well as for marketing in the country. And they submitted the dossier to the National Regulatory Agency. Unfortunately, it did take several months longer than expected for that dossier and samples to be submitted, and therefore we were not able to move forward with the additional activities that were planned, as you see there also on the screen. These are activities that can basically be commenced once the product is registered. And as our project is coming to an end next month in June, we were not able to wait for the registration to be completed to conduct these activities. Now, these activities included Sun Pharma contracting with a consolidator platform in France and to begin to sell to ABEV health facilities. Now, they have previously sold to ABEV with legal temporary authorizations. However, we hope that with the registration, it will be even simpler for Sun and for ABEV to conduct business. And what our intent was to incentivize marketing post-registration in Burkina Faso by a local promotional agency with which Sun Pharma had a relationship. And in this presentation, I will talk more about promotional agencies. Next slide, please. So to begin with our lessons, first, it is so important to understand the supply chain actors for Combi packs, including the manufacturers. We can see that on the left, we see the quality assured manufacturers who, now there are other manufacturers, of course, of Combi packs in the globe. However, we're focused on those who are presently significantly in sub-Saharan Africa and with an eye towards our project. And so Jeju, as we see here identified under the quality assured column, Jeju obtained their WHO PQ approval in the fourth quarter of 2019. And since that time, they have been pursuing registrations in select countries in sub-Saharan Africa, as well as in other areas. Line Pharma has SRA approval. They have, of course, a significant presence in some high-income countries, and they also are present in Latin America. Now, as we've been referring to Sun Pharma, they are also SRA approved and have registrations in a relatively small but growing list of countries globally. Now, Acme and NARI, of course, have a notable presence across sub-Saharan Africa, often working in collaboration with SMOs. And lastly, we have included here Viatris, which is the new legal name for what has been Mylan. And Mylan also has a Combi pack. Their Combi pack is not yet quality assured, and it is registered in a couple of countries in sub-Saharan Africa. Next slide, please. So the manufacturers really do play the decisive role in entering markets globally, and certainly that includes in sub-Saharan Africa. Now, at the outset of this project, we were engaged to pursue interventions to help distributors overcome barriers in registration and distribution to increase access to Combi packs. But we pretty quickly realized that it is indeed the manufacturers who are the primary decision makers in entering private markets. Distributors can't independently decide to register a manufacturer's Combi pack or even to be procuring it directly from a manufacturer. Now, in the next slide, we will be taking a look at the priorities that many manufacturers will be looking at when considering market entry. And while each manufacturer may evaluate the priorities differently, indeed, they are all motivated to register only if there is a positive, reliable sales outlook in at least one market sector. Next slide, please. And this is a look at the primary factors for consideration. The size of the market, of course, is very important for as manufacturers are looking to the potential for their presence for revenue as well as for profit. The saturation as well, but even if there are some other manufacturers who are present, if the size and health of the market support, they would likely still pursue entry. Now, the price points certainly do matter for MA in the market sectors, as well as looking at what the potential may be for national tenders, since that could enable greater presence in the country and, of course, more revenues. And if the manufacturer is working hand in hand with SMO partners, those SMOs' presence and their commitment in those countries would be instrumental. And manufacturers are looking at what is the enabling environment in the country. Is there a framework for safe abortion in the country? And are indeed sales in the private sector and to pharmacies permitted? And is active marketing permitted? And local partners, they would need to identify before beginning their their launch into a country. Next slide, please. So the commercial sector actors, as I think many of us know, do not often view Combi packs as simply one more pharmaceutical product. They realize the risks that exist with medical abortion, unfortunately, in our countries. Now, when it comes to marketing and detailing, there are multiple potential business models. We all are aware of the great job that SMOs do in marketing medical abortion across so many countries. Now, in some countries, there may be potential for a manufacturer to have their own medical representatives present to conduct marketing. Also, some commercial distributors have capacity for marketing, and promotional agencies are present in some countries, including in West Africa, in Francophone Africa, as well as in Central Africa. And these agencies employ medical representatives who conduct detailing or marketing of the products for their client manufacturers in the private sector as well as the public sector, with pharmacies as well as with health facilities. And each manufacturer may use different business models depending on what makes sense for them. And the usage also certainly varies by country. Now, distributors are not likely to actively market Combi packs. While there is the potential, and some distributors do have the capacity, it's not likely at this time for them to be actively marketing the product. Next slide, please. And commercial distributors vary significantly in size, in structure, and in capabilities. And one important way in which they vary is in the level of autonomy. While some may be relatively small, independent businesses, quite a few others are actually subsidiaries of large corporations that are based with their headquarters in other countries. And this is often the case in Francophone Africa, where the base of wholesalers is quite concentrated, and many of these are actually subsidiaries of large logistics corporations. Next slide, please. And here, just taking a look at the, as we've been discussing, that distributors are aware of the risks of selling Combi packs. They understand that there could potentially be backlash in a country, whether from in a community, from pharmacists, from the ministries, and they look to mitigate those risks. And that's often through relationships, through partnerships in the country, such as with an SMO. Next slide, please. Now, as I've been referring to, Francophone Africa does have distinctive supply system practices. The consolidators are large distribution platforms, organizations that are based in France. A manufacturer typically will contract with such a consolidator as they're looking to bring a product to market in Francophone Africa. The consolidator then, as they're contracted and as a product becomes registered, will be entering orders with the manufacturer, and they will themselves be receiving orders from the wholesalers present in the Francophone African countries, such as Burkina Faso. Now, the wholesalers are, while they will be receiving their supply from those French intermediaries, they themselves are receiving orders from pharmacists and health facilities in their country. And the promotion that is a necessary aspect of this process is the marketing that is conducted in the country to increase the product awareness through marketing, detailing visits to health facilities, as well as to pharmacies. Next slide, please. And as been talking about, as we understand, those of us who work in this community, there are so many challenges with markets for medical abortion, and combined with the relatively small supply base, this can increase challenges for growing markets. And as mentioned earlier, incentivizing distributors simply to register in a particular country is not going to be viable. It is important to look rather at what a manufacturer needs post-registration for access, for being able to conduct business on a sustainable basis. Next slide, please. And incentivization geared more towards the access post-registration appears more viable than incentives for the registration itself. But in any case, incentivization really should only be undertaken very cautiously, as mentioned, to avoid fragmenting markets that are already quite fragile. And sustainability is even more challenging to achieve with approaches. And one reason for this is that the relationships that a manufacturer may form with their local partners are not, of course, permanent. They could have a relationship with a local partner who they work with to get their supply chain going in a country, but then a year later they might be working with a different distributor if different situations have emerged. If the competitive landscape has changed, their relationship with the distributors have changed. So sustainability is even more challenging in this arena. And when it comes to incentives, it's best to think not about short term, say for a year or two, incremental incentives, which even prior to the pandemic would have been challenging to implement, but rather to think more long term about the greater challenges that are facing the supply chain actors and how to collaborate to mitigate those. Next slide, please. So in conclusion, as sharings some of our learnings about manufacturers and commercial distributors in the Combi pack markets in sub-Saharan Africa, we really wanted to help to broaden the knowledge base of these markets for our community. And thus we were sharing our report as well as this webinar. As I mentioned, our project is ending next month in June, but the coalition and our Safe Abortion Supplies Workstream will certainly continue supporting MA market discussions and activities with all of you. And I believe that is the last slide.
Thank you very much, Safia, for this amazing presentation. And so there were a lot of information. And just we are a bit short in time, so I will give the floor to Ben from Navy. If Madison can kindly share the slides as well. And
Great.
Thank you.
Thank you. Thanks, Lawrence. So Ben here, glad to join you all today. I'm going to basically tell a story in 3 parts with a prologue about what NIVI is. So a lot of slides, but hopefully I can kind of focus the story here. So the prologue, essentially NIVI is built as this, with the ambition, the vision of enabling access to health through phones they have available in their hands. We want to basically put the power of one's health journey in one's own control. And so we see that as a universal aspiration and a vision motivating the development of our platform. So next slide, please. The platform has been built around this to address a problem, a universal challenge around information or the lack thereof. We see, certainly most evident in the COVID pandemic, the most well-resourced health system in the world, if you think about it in terms of money, GDP per size of the economy goes into healthcare, for instance, or in this case, physician to population ratios. The United States has a significant or favorable ratio, but despite having many of the prerequisites to a functional and effective health system, an ability to help populations achieve their health, we still stumbled domestically because of this challenge around information. The ability to organize ourselves is predicated on having high quality information and sufficient information, and both at a patient level and at a population level. If you have that high quality and that high consistency or expansiveness in data, you can improve, you can have effective engagement. And that's really fundamentally what we're looking for with information, is the ability to engage both at an individual level between patient, provider, or consumer and contact points in the health system, or at pharmacies or other kind of near retail events in health systems, or at the population level as means of engagement between groups. And so that's really something that the challenge we took on at NIVI. So in the next slide, you'll see that we approach this challenge by addressing information to individuals in messaging channels. So we use popular messaging channels like WhatsApp and Facebook Messenger to enable self-care, to supply actionable information. We've already done this for several million people in the 4 countries we operate, really built around this idea of self-care, beginning prior to COVID, but certainly accelerating during 2020 and now in 2021, looking to expand our ability to engage individuals in meaningful conversation. And then from that digital engagement, we can derive trends, patterns, and even some predictive capabilities in aggregate from the collective total experience that users are having on this platform. And that becomes of interest, if you will, to our potential partners. So early on, we heard NIVI's essentially serving nonprofits, for-profits, and state agencies, those organizations that either want to optimize engagement with their own populations or reach out to NIVI users. We provide the tools to do so. And so those tools are built off the insights from this conversation. Next slide, please. It's a cyclical process, and it's an iterative process, one in which that engage, chat, act, that call to action, that marketing campaign, that awareness raising or mobilization effort that takes place prior to any chat taking place. There's a series of marketing campaigns that call users, and if the message resonates, they click effectively on their phone and opens up WhatsApp or opens up Facebook Messenger, where they begin these conversations that then lead them to some event, an action. It might be going to a pharmacy for an MA kit. It might be going to a clinic for a procedure, for a method, or it might be follow-up on care that they're routinely receiving. So this idea of being able to engage and re-engage is important. And our consumers, rather the customers, the folks that are interested in who we reach, the data we're able to generate is of use as insights to our partners. And so you can begin to see and aggregate these patterns, and those partners can then use that information to more effectively engage their populations of interest. So that's NIVI in a nutshell. Story one. Next slide, please. So I wanted to give you a bit of an idea about what we're doing in India. And this is essentially key outcomes. I retitled this after I'd sent the slides last week, but it's really this idea of understanding what we've done in India on our objectives last year, 2020, and into 2021, which is what the bulk of this presentation is about. We wanted to expand our ability to provide content, extend our content library, and the underlying architecture to make referral possible along medication abortion, along helping inform consumers on what their options are, helping them discover where to go, and to help them once they've decided to self-manage an abortion at home, helping them through that process with information that is available via the phone. We wanted to enhance our insights to help understand what those pathways that users are following look like, and then ultimately to build out that referral network to be able to help consumers act. How do we do that? Well, we do that by guiding or providing guidance to consumers who are motivated, self-motivated, who are opting in to now find solutions to their problems, their challenges they're encountering, and ultimately achieve their health objectives. So next slide, please. So what I'll present here in the second part is really some of those initial insights that came out of last year. So this is largely work done in 2020. Next slide, please. And really we found that there's a need for, this is self-evident, a need for information and education around medication abortion in the post-MA family planning space. And it means, and there's interest in an engagement around there's a lot of user engagement around MA conversations. So the medication abortion conversations on the NIVI platform in India, we've seen a lot of interest in this. So there's both maybe some misconceptions, if you will, in what users think they understand, and the sort of questions that they're posing. And then the engagement we see on these conversations suggests there's a lot of demand, if you will, for the information itself as an endpoint, and then to where to go in the event that they want to act. They're looking for means to do so. So next slide, please. When we say engage NIVI, and at what scale are we talking about? We run marketing campaigns to raise awareness around concerns consumers may have about an unintended pregnancy, or questions around conception, and the response we get from that converts to users landing in the chat. So when we talk about users engaging in conversations, these are users who have accepted terms and conditions, provided age, gender, and location, and are now having conversations, that is messaging back and forth, often with key press response to questions we pose to them, but having conversations nonetheless around medication abortions. And we reached in that time period from January 2020 to February of this year, over 100,000 users on these medication abortion conversations. And what we'd like to see is that initial interest convert, that there's this initial interest that leads to further exploration of topics relevant to users. And so about 21,000 users then engaged in conversations around the MA kit, guidance around that, and then 4,600 users engaged in conversations post-MA on family planning options, suggesting that they had either moved through the top to the bottom of this schematic, or were joining and having these post-MA conversations because they'd learned about NIVI and were coming in at that point looking for the sort of state-specific information. They're looking for rather this post-MA family planning options. So you can get a sense of what that overall, if you want to call it a user funnel or kind of a user experience, those pathways look like. In aggregate, that's what they come out to on the platform. Next slide, please. In terms of who we're reaching, broke it out by age and gender just to give you a sense of who's been on the platform. Again, these are a subset of the overall users. In India, we've had close to 2 million users in aggregate since we launched there in 2019. So these 100,000 from last year are a subset of the overall user base. But of those 100,000, the majority were many male partners, interestingly enough. So 73% were men seeking that sort of guidance and engaging with, at the top of the funnel, information around MA, many of them. And then in terms of age, we're getting a young demographic, 39% are 18 to 24, but the largest group being 25 to 34. So you can see in terms of those combined age groups, 18 to 34, a significant number of our overall user base. So large numbers there. We're finding that 2 out of 3 of these users that are accessing the MA content, of course, belong to this reproductive group, the 18 to 34 group. We're getting a lot of men, as I mentioned, and that's generally what we're seeing in India on other conversations aside from MA. So our MA users are often representative of the country, of our user base in India. Next slide, please. In terms of general MA information, if you look at medication abortion as a set of conversations and compare that to method-specific conversations, family planning methods, contraceptive method-specific conversations, condoms, natural methods, well, maybe another form of self-care, OCs, OCPs, copper T, that sort of thing, that medication abortion is quite popular compared to specific contraceptive methods, but family planning methods in aggregate, this idea of what is family planning, reaches or has more users. So you can see the numbers here essentially tail out. We had 143,000 people in this 13-month period engaging family planning method conversations, contraceptive screening, which is a decision support series of conversations, essentially taking the Pop Council's balanced counseling strategy plus cue cards, flipping that as a consumer-facing experience, and then making that a decision support process that with a few key questions, you can help consumers identify more appropriate and most relevant methods to them. So that remains slightly more popular than the medication abortion conversations, but MA is a close third. We're getting a lot of people there coming in on that topic. Next slide, please. And so 2/3 of users, when we begin asking about, so in addition to back up here. In addition to providing information, we can also solicit information through quizzes and questions out to the users about what their states of knowledge are, kind of what they understand, what they may not understand around MA. And so we began asking users, and 2/3 of them believed that women needed permission for an abortion from their partner or family member. So there was a significant issue around that. Next slide, please. We began seeing whether users are split. Is it safe to have a medication abortion without confirming how many weeks or confirming your weeks in pregnancy? The majority, a slim majority, said it was safe without confirming. Next slide, please. And then, is it safe for women to take home remedies such as herbs for abortion? Again, a slight majority said it was safe. And so you're seeing these. The state of knowledge is that there's room for improvement, effectively, in this user base, and the need is there. Really think of this as an opportunity to serve, and being ready, being available, like NIVI is, as a agent, if you will, a health companion, on the phone and with information that can inform. I won't say correct, but kind of provide a scientific basis for confirming, the state of knowledge or addressing gaps where there may be gaps, being able to say, oh, that's interesting, and have you tried or considered that the National Ministry of Health or the WHO recognize the importance of getting gestational age, for instance, or that herbs can be dangerous, or they're trying to think how we would frame that. But there are ways in which you can correct these misconceptions essentially on the platform. So marketing is about bringing people into the ecosystem, giving them an opportunity to explore these topics, address some myths and misconceptions, and then ultimately helping consumers connect to the service providers in the third part of this story. If you'll go to the next slide. We began marketing campaigns in February this year. So the marketing campaigns were not only to raise awareness around the information, but to help guide consumers to potential points of care. And this is an earlier state of development for the platform. We're just getting started. Part of the reason today for the conversations is to see if we might start some of these conversations with you. And yeah, so next slide, please. So we had two initial partnerships that started as a family planning focus, but had some possibility of adding or engaging users on MA topics as well. These were digital campaigns to drive that user engagement and ultimately help refer to points of care in northern India, so in UP, Rajasthan, and Madhya Pradesh, with two different partners on the ground that have these essentially networks that we can refer to. So these are now, how do you act on that information? Well, these are examples of places that individuals can go. So next slide, please. The overall approach is to launch these campaigns in February to support both family planning and MA access, and to drive those, to help users who want to go themselves to now be able to find that solution to their challenge, to their health goal. So we designed creatives, and I'll show you a bit on the next slide, that are featuring young couples and women that are kind of relatable and help users imagine themselves taking action, crafting these messages that further that, and of course making it locally relevant in languages that are relevant to the end user, obviously. So that was incredibly important. Next slide, please. So these two slides expressing relief that we don't want to make such mistakes again, using euphemism and ways to communicate or communicate a message without having to, well, in ways that will work on social media, because there are constraints in topics you can address. We find positioning ads, it's strategic to be just using metaphor and creative language to reach our users, suggesting ultimately people take action by chatting with Nivi and recognizing sometimes small mistakes in life can be troublesome. And that's why we always need a backup plan. Chat with Nivi to learn more about taking control of your future with various contraceptive methods. Or the second one, that was a close call, we got saved. Chat with Nivi. Again, helping individuals understand that there's an option available, a second chance, a way to reconnect and move forward with information provided through Nivi. So next slide, what does that mean in terms of reach? Those ads and others like them, we were able to put in front of almost 500,000 people. We had 6,000 individuals click through on those calls to action, which was a conversion rate of about under 2%, 1.5%, but better than industry benchmarks, as best as we can say, from comparable metrics. And that's it is a bit of a trying to suss out what's the best benchmark available, but that's what we're working with now as our baseline, and looking to then think about what those unique outbound clicks or numbers of users going out to referral look like. Tracking conversion has been a critical part of how we understand performance. So these are early days to get baselines. These are not where we're not satisfied with what we're seeing so far. We're working to improve on that, but this does give us a means to understand early what some of those pathways look like. So on the next slide, I want to show you what that user journey looks like. Those 6,800 users clicking on the MA campaign ads, of which 570 users then onboard, 576. We've got 368 engaging these MA conversations. So yes, these numbers are early, but we're being able to now suss this out. It's simply a matter of getting more users on, if you will, to the front end, or more users coming through the top with expanded ad campaigns, and then fine-tuning the message at every stage so as to make this more meaningful and see those conversion rates improve, which we've done in other types of services with family planning in specific geographies, and we're keen to do this as well with MA now. So one way we'll do that, next slide. On the next steps, if you go to the next slide after that, are to make some updates further to the platform. So we're revamping or launching what we're calling hand-holding content to provide more information during that self-management of MA, as well as strengthening, so that strengthening the post-MA family planning messages. That idea of improving those conversion rates will be very important, certainly in settings for post-abortion care. We want to be able to refine and deploy our re-engagement functionality. So we're boosting our ability through micro experiments and rapid iteration to build on what we know works in terms of nudges and reminders to make that a more engaging experience and a more meaningful experience going forward. And then from that ability to re-engage, develop better insights, let's say deeper insights. Say they're good insights already, but deepen that really to suss out more pathways and more of the idiosyncrasies that users have as they engage with chat to help lead them through ultimately to their health goals. So examples on the next 2 slides, and I'll be very quick here because I realize we're at time. There are 4 slides actually. I want to be very quick. So launching this MA self-management hand-holding content. It's about introducing the idea, making sure you're in a safe place, that you have a friend with you for support. Do you have what you need? Are you ready to continue? And going through these step by step and timing them so that they're set up in such a way to reach the user within hours of initiating the conversation. So once they're ready, take the formisoprostol, take the tablets, and then here's what to expect. So on the next slide, you can see that, oh, this duplicated, didn't it? That's funny. Anyway, so I'm going to, next slide. I think these got duplicated. They did. All right, so there were only 2 slides. That's great. So this here is the messaging then, checking in once she's taken the tablets. Once messages ensure she's getting the information she needs and keeping her in charge of her journey. So checking in really closely here, 4 hours later, first check-in, a day later, second check-in, 5 days out, 21 days out. So this idea of being able to follow up and re-engage is critically important for the MA service experience and the user journey in that process. Looking for outliers in symptoms that may be indicative of needs to seek care, and really ensuring at the end of the day that the objective was achieved, that she feels like she's achieved her journey. So that's an important part of this process. So that's where our next steps are. It's what we're currently engaged in. Next slide. And the last piece of this, of course, is now we've built this and the platform's up and running. We're getting the users. We're looking for partners. We're looking for ways to grow that referral network, to find additional partners who see value in the sort of user engagement. So I have examples here of organizations that we're keen to work with and deepen relationships with. So these and others, those of you on the call today, would be glad to talk if there's interest in exploring this further. So thank you very much.
Thank you very much, Ben. This is amazing work, and it's showing a lot of innovation in using technology, which is great. And I think it's very useful for the safe abortion sector. So I think we have a lot of different questions. I doubt we will have time to answer all in 3 minutes. So what I suggest is the remaining question we will answer by email while we share the presentation. So maybe I can start with the first question from Somia, and I think it's addressed to Safia. So does the consolidator able to negotiate better prices based on volume, or any benefits in price eroded by the addition of consolidators and wholesalers in the supply chain. And I also had a complementary question to that, is if does that model also has been observed in any other Anglophone country? And would that be something that could be explored to encourage manufacturers to register in more countries? So Safia, if you could kindly answer. I don't know. I cannot hear you, Safia. If not,
Yes,
Unmuted.
excuse me. Yes. Thank
okay.
you, Florence. It's a rather complicated response and certainly not something that I could answer within 2 minutes. I'm sorry, but I'll be happy to answer it in written form in email if I could.
Yeah, that's good. Thank you, Safia. And I think I can take one question for Ben. It's what can be done to expand the top of the funnel, and secondly, our provider responding to this data, are they different from their knowledge of the customer? And Natalie completed the question as well. And does NIVI give information advice about which medical abortion products to use in a particular setting? So Ben, if you could kindly answer.
The top of the funnel one is, I think, the easiest one to address, and these are all great questions. Yes, we can easily expand it. We have expanded over time. Specific campaigns can be more effective than others in terms of reaching, tens of thousands or hundreds of thousands of people even with that call to action. We do this through a combination of paid advertising on digital properties as well as organic growth, which we've been building recently in India, Kenya, South Africa, and Nigeria, where we operate. So that entails search engine optimization. So when people enter search terms looking for, say, abortion or reproductive health services, NIVI comes up near the top. So there's that SEO component, and then pointing them to a landing page, a NIVI landing page, where they learn more about what that chat experience looks like before they have the chat experience. So all that's critical consumer education components that go into an effective widening of the tunnel, or broadening of the funnel, rather, at the top. In terms of the implications back to providers, that's early days. We look for that re-engagement data to tell us more about the experience. Did the user achieve her health goal? Were there challenges she had along the way? Did she get the service she wanted? With family planning, we can ask the Method Information Index Plus questions to rate the quality of that counseling event. With MA, it's still early days to understand quality per se or get feedback on that experience. So I'd look to partners here to help flesh out that content. But that's certainly useful information, could be used for program purposes to manage providers who may be needing improvements in their own counseling or quality improvement. We can use this sort of patient-reported experience to inform that quality improvement process. So good good questions from the presentation. Glad to answer the rest of these offline. Thank you.
Thank you, Ben. I think people are starting to leave, and I think it would be better if we can answer the remaining question by email. So we will be sending it the answer with the questions, with the presentation, of course. And thank you so much for the presentation, Safia and Ben, and for all to attend the webinar, and looking forward to the next one, and wishing you all a great evening or day, based on the different parts of the world you are. So have a good time. Bye bye. Thank you.
Thank you.